Good evening, everyone. I'm Purnima Prabhakaran, Deputy Director of the Center for Environmental Health at the Public Health Foundation of India. On behalf of the hosts, the Center for Environmental Health at the Public Health Foundation of India, the Health and Environment Leadership Platform under the Center for Chronic Disease Control, our Indian Institutes of Public Health, and the Medical Students Association of India, it's my pleasure to extend a warm welcome to all the participants this evening. A very happy occasion on the occasion of the World Environment Day 2020. However, we all recognize that we are living in very unprecedented times with this global pandemic that has wreaked havoc across geographies across the world. We have learned to live with this lockdown in India. We have learned also to get accustomed to living and moving in the virtual space. We have been inundated with information and opinions from every forum, from social media, from the televisions, and from the innumerable webinars that are being hosted across the board. So on the occasion of World Environment Day 2020 today, rather than hear from expert professionals, we thought we'd host a very unique interactive discussion, bringing together medical students and students in public health from our own institutes of public health across the country. So without further ado, let me introduce to you the webinar for today, Reclaiming Planetary Health, Youth for Health and Youth for Nature. And we have panels this evening. The first one is themed 19 perspectives from the student community in medicine and in public health. To moderate this discussion and chair the session, we have with us Professor Srinath Reddy, himself a clinician, a renowned clinician who headed the Department of Cardiology at the All India Institute of Medical Sciences, but thereafter has been the president of the Public Health Foundation of India since its inception, a globally renowned name in public health, so most well positioned to host this deliberation between students from the medical community and the public health community. So may I hand over to you, sir, for hosting and moderating the first panel on COVID-19 perspectives from the student community.
Thank you very much, Purnima, and welcome to the event. COVID-19 may seem like a zoonotic disease, but it has environmental beginnings because it is the extensive deforestation as well as the large-scale animal farming that actually creates the conveyor belt for the transmission of viruses from wildlife into veterinary population and into human habitat. Therefore, it's very befitting that we actually look at COVID-19 also from the environmental lens. But to actually share the thoughts of the younger generation who are now grappling with this challenge, which is now casting a bit of a shadow on their future because of its effect on health as well as the economy of the country, we have two young youth leaders, one from the public health colleges and one from the medical colleges. And let me invite them to first respond to a question that specifically relates to COVID-19 as it has played out in the country. To discuss this from their respective perspectives, we have Sai Krishna from the Indian Institute of Public Health, Hyderabad, and Purva Prabha Patil, who is the president of the Medical Students Association of India, who is from Manipal. So let us start off with Sai Krishna. What is your perspective now on how COVID-19 has played out for you as a student of public health? What has been your experience and what are your insights into COVID-19? And what are your perspectives on how, as a young person, it has affected you, and how do you see it playing out in the country now?
Hello, sir. I am Dr. Sai Krishna. I have done my graduation as a homeopath from JSPS Government Homeo Medical College, Hyderabad. I have done my MD also Recently, I've joined in MPH Hyderabad at Indian Institute of Public Health, Hyderabad. COVID-19, it has shown the world the importance of public health. Whole world and actually all the industries are staggered or stopped because of the pandemic. And it has proven the need for raising the health budget allocations. Actually, it is in India, the GDP, it is only 2% of the GDP, hardly 1.8 or 2% of the GDP. Now, COVID-19 has raised the question of is it sufficient or not? And it has increased the importance of health experts. Like we are seeing Dr. Fauci from America, and actually we are seeing you regularly in the newspapers these days. It has raised the importance of public health experts, and people are seeking their advices, and media are covering their news on the front pages. And it has shown the possible opportunities for public health graduates. We have seen recent openings for public health graduates like epidemiologist posts in Hyderabad and various parts. And it has exposed actually what is the ground reality in the nation. We have seen like every time in any pandemic or any disaster, the most vulnerable people are poor and disadvantaged people. You can see the number of laborers who are walking miles together without food and water and without even footwear. There are policies which have been long pending, like one nation, one ration policy. It was it was for the pandemic to bring these policies into action, is what I felt, because during their walk, these migrant laborers suffered a lot for the food. If there was a policy like one nation and one ration, they would have got their ration at any place along their way. And the same applies to various other public health policies like ban on the public spitting. According to I belong to Hyderabad, so I know something about Hyderabad Municipal Corporation Act, in which there is a section called 488 which bans spitting and open defecation and urination in public. But nobody paid any heed or nobody paid any attention, and there was no publicizing about this act earlier. But now people have realized the importance of these kind of acts, and even central government has also passed a ordinance or law. I don't know, I mean exactly, I don't know the difference between an ordinance and law, but they have passed an order saying that spitting in public places is banned in view to contain the transmission or possible uh, spread of the viruses like COVID-19. And we have seen that people did not oppose. There was a liquor ban for 40 days, but nobody opposed it. All these days, they were very patient, and many people thought of even quitting smoking and alcohol because of this imposed ban by the government. So it is we have to rethink. I guess we have to rethink about the strategies about quitting alcohol and smoking is what I felt. And schools and colleges are closed. So schools, colleges, and even offices are closed. So everybody is forced to work online. Even we are working online. Doctors are forced to make online consultations. Earlier, it was opposed by the government to make any, if a doctor makes any online consultation, but now they are promoting that. This kind of things even bring brings us to a situation where doctor is forced, doctor cannot examine the patient, and there will be more investigations. They are forced to write many investigations to the patients. That kind of burden will also be there, and there will not be any personal touch kind of feeling. Patient will lose that personal touch feeling with the doctor. And we can even expect or anticipate problems like a new sedentary life, new lifestyle disorders, because of the changed workplace, changed work conditions. Earlier, they used to work in offices where there were ergonomically designed chairs or ergonomically designed desks and everything. But now they are forced to work from home, where the, their convenience will not be there. So we can expect a large number of cases of cervical spondylosis or lumbar spondylosis and the like. So we have to prepare policies or make changes in our lifestyle disorders. We have to bring changes in the policies is what I felt. And online consultations of the doctors are also becoming very popular. And as a homeopathic doctor, even I am doing online consultations these days. And there are various ways people are trying to create awareness about the corona. Most impressive thing which I felt is corona color tune. Corona color tune. By that way, like, I mean, it is a very cost effective method. Everybody is forced to listen to that alert message, like don't discriminate or don't spit in public places, or what are the wash your hands or anything. There is a caller tune played before every call. Like that, we have to reinvent or rethink about the cost effective and highly reachable strategies, innovative strategies about the corona, I mean, about various other diseases also.
Thank you.
And COVID has also exposed the lack of a proper medical infrastructure and equipment. But within 3 months, 3 or 4 months, earlier we did not have any PPE production in India, but now we are able to produce like 4 or 5 lakhs of PPEs, and cost-effective ventilators. Ideas were proposed by someone like Mahindra, who came up with the idea of ventilator simulator within 7,500 rupees. So it proves that we have unbounded potential, but a unified direction or unified guidance is needed. So someone or somebody can guide us. All in all, as a student of public health, this pandemic made me rethink about my potential and prepare accordingly to face the new challenges. Thank you, sir.
Thank you. Purva Prabha Patil is the president of the Medical Students Association of India. She is from Manipal. So Purva Prabha, as a medical student and particularly as a leader of the Medical Students Association of India, what has been your perspective on how COVID-19 has played out, both from your personal point of view and from the point of view of your association?
Thanks so much, sir, for that question. And it's safe to say that it has been a profound learning experience for all of us in one way or the other, and in more than one ways for a lot of us. And I can say the same about myself as a medical student, and as also somebody who's involved in the leadership of the Medical Students Association of India. First and foremost, I think just for the sake of understanding, I would like to divide my response in a couple of fragments. The biggest impact that as a medical student I've felt is on my education. And I think over the last 3.5 years of me studying MBBS, I've never really acknowledged and realized the true value of my clinical postings. And this has been a time of introspection for all of us. It felt like a punishment to go to the hospital every day and just be there for 4 hours and perform all sorts of tests and examinations and history. And I think it's the last 3 or 4 months have given us enough time to look back into how we feel about that. And at the same time, it's impacted all of us very differently in terms of first years. This is a year to go out, learn more about the human anatomy, see specimens, and interact with colleagues, make friends in medical college. And it's tough. It's very difficult for first years and also for final years. With I'm myself a final year, and with the volume of syllabus that's already very stressful, the uncertainty of how we are going to kind of combat this challenge, or how we're going to write exams, or this year I envisioned that I would put together everything I've learned in the last 3 years, and it would be like a puzzle coming together. But that didn't necessarily happen because of COVID. But apart from that, I mean, there's too much to talk about how it's impacted us negatively. But then it would be a shame to not talk about the positive changes that COVID has brought. First and foremost is rethinking healthcare, rethinking the importance of healthcare in our policies, in our lives, as health professionals, as beneficiaries of the healthcare system, in terms of just how important really basic things are. In the course of our medical education, we more or less take hand sanitation for granted, which is very basic things like hand washing, keeping safe distances, safe practices while sneezing or coughing, and just knowing that despite being such basic practices, there is such a big lacuna between the understanding of the communities we're serving. And I think that's come out really strong with the pandemic. Apart from that, I think at least I can say for people that I studied around and studied with, PSM or preventive and social medicine or community medicine was not our favorite subject. For me, it was one of mine, but that's not what the majority thinks of it. And COVID just, and I still remember having this conversation with my colleagues on why are we doing this? Why do we have to study how an epidemic is traced? We've never seen an epidemic. Likely we're never going to see one. And boom, a year later we are here, just rethinking contact tracing and why it was important, how it was done. So I think it's been an eye opener in that regard. Apart from that, it's also showed us how much strength there is if we're determined to do something. There were so many lacunae to be fixed in the healthcare system, and we have seen from not having PPE to just creating $1 million industry within a month or within 2 months and becoming one of the world's leading manufacturers of PPE. And there's scope to do so much more. And I think it's reiterated that necessity is the birthplace of innovation for us. And apart from that, also morally for me, I've always constantly been in the dilemma of I'm a medical student, I'm not a full doctor, so I don't know how much is ethical for me to contribute, but also just morally feeling that I'm a medical student, I've spent 3.5 to 4 years studying medicine, and it's a waste if I cannot be of help now. So as an organization also, we decided to partner up with the Academy of Family Physicians of India and help in contact tracing, help in data collection on changing trends in COVID, what interventions helped, what interventions didn't help, what we could do better, how we could contribute as medical students. And then a bunch of us were trained in taking online consultations, and just everything happened so quickly. But there is a lot of potential for change. And one thing that COVID taught me specifically, and also I can speak for a lot of my colleagues, is if you're really determined to do something, regardless of where, in what stage of your medical education you're in, you will always see a silver lining in a dark cloud. You'll always find opportunities to make real change.
Thank you very much. So that's a very optimistic note. Let's hope we can carry on with that. For the second question, let me reverse the order and start with the representative of the Medical Students Association of India. We have Arpita Pava, the National Officer on Public Health of the Medical Students Association of India. She is from Delhi. Arpita, in a hypothetical situation where you are the decision maker, what would you have done differently as a first-line COVID response? If COVID had actually been spotted in India, just afresh, then what would have been your response, Arpita? If you had the decision-making power, how would you have guided India through the process of countering it effectively?
So good evening, everyone. Thank you for that question. I'd like to start off by saying that India currently has over 1 lakh cured cases, and we currently have a cure rate of about 48%, which is the highest in the world. And this is only possible because our government, both at the state and the center, took timely measures. However, as the English poet William Blake has famously said, hindsight is a wonderful thing, but foresight is better, especially if it saves lives or saves pain. So despite the impressive recovery rate, we do have over 2 lakh cases, and we're the 7th most affected country in the world. So having said that, I feel that India, with a country that has over 100 medical colleges and with almost 30,000 fresh medical graduates passing out every year, I would have liked to use our existing and vast human resources better. with proper coordination between the center and the state medical councils to ensure that all medical practitioners in the country could have been mobilized. Uh, Also, Anganwadi workers and accredited social health activists or ASHAs, they form the backbone of our primary healthcare system. And in my opinion, we should have trained them and used their expertise more efficiently in contact tracing and in curbing the spread of misinformation. Medical students are always over enthusiastic to participate, and they could have been used as an asset, and their willingness to work voluntarily could have been put to good use, again in contact tracing and in fighting the various myths regarding the disease early on in the early on in the pandemic. India is also home to a variety of other alternative fields of medicine like Ayush and like Ayurveda and homeopathy. So I felt like we could have involved the Ayush sciences more instead of alienating them and considering them non-essential workers. An interesting point I felt was that misinformation we saw was very rampant early on in the pandemic. So religious leaders in our country have a huge following. So if we could have trained them to reach out to the masses and to spread proper information, I feel like the general population of India would have responded to them better. Uh, Also, we saw that during the initial stages of the lockdown, there was a lot of panic buying and a lot of hoarding of essential items, including masks and sanitizers, which also led to skyrocketing prices. So the government should have put up a system of checks and balances to ensure that no such hoarding took place and that there was equitable distribution of these essential items, especially among the most vulnerable population. Uh, as a result of all this hoarding, our daily wage workers found it difficult to afford these basic amenities, which put them at an increased risk of acquiring the disease. People ended up buying hundreds of masks and sanitizers in bulk, which also contributed to the widespread shortage of these commodities in our country. Uh, Also, attacks on healthcare workers is something that has always been an issue in our country. And the same was seen during this pandemic as well, wherein doctors and other essential workers had to face unruly mobs when they went to work in various parts of the country. The ordinance that followed these attacks could have been brought in earlier to protect the frontline workers and to ensure a proper working environment for them. Uh, I would like to conclude by saying that hindsight is always 2020. India has so far done reasonably well, given our population, given our economic status. But these are some of the improvements that I feel we could have made in tackling the given pandemic.
Thank you very much. We'll now have the comment from Vishak Saraf, who is doing his MPH at the Indian Institute of Public Health in Gandhinagar. Go ahead, Vishak. What has been your experience? And based on that, if you could look back and if you were the decision maker at the beginning of the epidemic in India, what kind of decisions you would have made?
First of all, sir, it's a big privilege for me to be able to speak in front of all of you. Second thing, sir, in my perspective, this is not a hypothetical. Each one of us young leaders might potentially be facing something like this in the future. We have to think about it in a way that we are planning for the future. So we used to say a few years back that the age of the great pandemics, epidemics are over. And just look at us now, 198 countries affected, every part of the world which has been left unscathed. What we have to look, sir, that what development has happened and what are the things that have been left behind since the Bore Commission came into power in 1948. It has been 72 years, but the entire COVID saga has laid bare our weaknesses. We have to realize that we cannot leave the entire onus on the doctors and the frontline workers of our country. Day before yesterday, I was looking at an article by a very prestigious publishing house about the condition of ASHA workers. And in one specific case in the state of Haryana, 4 ASHA workers had to cover 1,400 houses in a fever survey. We cannot have this kind of over reliance on the existing system, which itself is crumbling under the weight of NCDs and other challenges. What we required right now, and what if I had the power to plan this thing, what was required at right now was to go at the baseline and make certain structural changes. Firstly, the Epidemic Act had to be amended like it's an emergency, because the act is basically a colonial vestige. It has to be modified according to the modern times. Second problem that I found with the entire response was the number of tests. By the time the scaling of the number of testing had begun, I felt that instead of one big super spreader event, which was attributed to quote unquote causing an explosion of cases, I felt that before that, a lot of cases had already started spreading into the community. Second would be immediately act as if COVID is in community transmission. Mass testing, door-to-door surveys without any stoppage. Fourth would be not only scaling up the production of PPEs and other equipments in our country, we had to get more of them, stock them up, right from the point when the disease started going international. We knew that this point will arrive, that we'll have 2-3 lakh cases in the country, a mortality rate of 5,000. The most important thing which I feel right now is the left behind cases, the all-cause mortality survey, which has to be started at some point. We have to see what deaths are being missed out. Who are these people who had been turned away from the hospitals just because they were not exhibiting the typical signs and symptoms of COVID-19? Again, the very nature of COVID-19 itself has caused a major challenge to the entire medical fraternity. It is a disease unlike anything. We have heard of cases with O2 stats going to 60-70%, just sitting up on the hospital beds as if nothing is wrong with them. And then we have had people, if I have to quote, a case of a Delhi policeman who got diagnosed on Sunday and he died on Tuesday. With a disease like that, we have to have a hands-on, very, very proactive emergency approach, which I felt our government did not initially have. Another thing would be the opening up process. So the containment policy that is being followed by the government is robust. So is the contact tracing policy. But I feel at the moment, there are reports, for example, coming in from Mumbai, where the ASHA workers and other frontline workers are actually skipping houses because how overworked they are and how overstretched they are. So again, the whole point here is that we have to turn our entire health system into a war footing. And that is something I would do differently. Considering how environment is changing, I'm pretty sure that any of us, or maybe all of us, might be grappling with the same issue 20 years down the line, with another novel virus shaking the very foundation of our healthcare system. Thank you so much.
Thank you very much. That was a wonderful exposition by both the medical students as well as the students of public health. Clearly, India has faced a major challenge, and it has exposed both our deficiencies and strengths. The deficiencies have been outlined in terms of a weak health system, particularly at the level of primary health care, even in hospitals, the overworked staff, whether it's doctors or nurses, or in the field, whether it's the ASHAs or other primary healthcare workers, all of them currently suffering from an excess load of work and unable to actually meet the challenges of increasing demand on their time. At the same time, we have also seen some of the negative features, as have been mentioned, of shortages of equipment, as well as hoarding of essential personal protection equipment. And all of these have also caused some concerns. There have been some mentions about how the medical practice has changed into telemedicine, distancing the doctor from the patient with the potential for more unnecessary tests being ordered and so on. But we have also seen the positives that have come up. We have seen the resilience in which we have actually now started developing our capacity for production of many of the medical devices as well as the pieces of personal protection equipment, and therefore long neglected self-sufficiency in these areas is being restored. We have seen, as has been rightly pointed out, a greater awareness of the importance of the health system overall, but particularly of public health. There's a greater consciousness of even simple things like hygiene at the personal level, but of also necessity to actually implement laws and regulations that have been long forgotten, whether it is spitting or other types of regulations that have been talked about. So there has been a change in the way public health is being perceived and health systems are being perceived. But there is also a recognition that we are paying the price for considerable neglect of the past, because a health system which is under-resourced, both financially and in terms of human resources, cannot suddenly build up a surge capacity. Despite the heroic work being done by our healthcare staff, whether in hospitals or in primary healthcare, the fact remains that we have actually neglected our health system for long. And this is where now correctives must be applied on a wider scale. And it's been rightly pointed out that it can't be the effort of the healthcare team alone. You have to bring in citizen participation as well as other streams of healthcare. Ayush has been mentioned, religious leaders have been mentioned, citizen representatives have been mentioned. All of these sections will have to now unite into a common front in order to provide a sufficiently robust response to this particular epidemic. So building these coalitions and partnerships at the community level is also going to be extremely important for us. And I'm very happy to note that the medical students and the public health students are both looking at this not merely as a depressing challenge, which is going to be dousing their spirits, but as a challenge that they would like to meet as able young leaders who are creating the way for a healthy future for India, recognizing some of the problems, but also trying to think of solutions for it, and ensuring that in future, if there are challenges, their own creativity and readiness to respond will come into play. May I just leave on a positive note? It's been mentioned that we have the 7th largest number of cases in India. One of the things that we must learn, whether it is in PSM or in public health, is that any number like that needs a denominator as well. When you actually put that number in the numerator and when you put the population of India in the denominator, we find that the number of cases are not as many as in many other countries when you adjust for the population. But that doesn't mean that we should be relaxed or negligent, but we should actually ensure that our numbers of cases can be contained, our death rates will be low, and certainly we must prepare our health system overall, whether it is a broader public health system or the healthcare system which provides individual care, become much stronger over the years, better resourced financially with better human resources. But most important is to ensure that we build in partnerships with other sections of society, especially the people, so that we can advance public health and healthcare in the right manner so that we can prevent epidemics as well as handle them with speed and success if they do occur. But thank you very much for the bright minds and for the excellent contributions you have made.
Thank you very much to the panelists, both from the public health community as well as the medical students. Thank you, sir, for hosting and moderating that discussion. There are a few comments in the chat box. I'm not sure whether I should direct it to you. We could take about 5 minutes. There's one question asking, why are we not using a horizontal approach to deal with this pandemic? Different states are facing different issues, and a population-based approach for prevention. We still seem to be more focused on curative care.
Well, basically, if by horizontal approach you mean that each state should be able to take its own decision rather being guided entirely by central policies or diktat, I would agree with you. Certainly in the face of a new pandemic, particularly when flights are coming in from outside, bringing in potentially virus-infected persons, there has to be a national policy that has to set in motion. And the response has to be organized at the national level through center-state consultations. But as the epidemic advances, certainly you need to actually move to the state level and then into the district or even the sub-district level, where the decisions will have to be made on data collected and analyzed as close to the field as possible. So having policies made at the central level, planning at the state capital level, but execution or implementation at the district level, or even actually at the ward and village level would be the ideal way to go. And even if we had begun with a slightly top-down approach, this is the time for us to decentralize. Decentralization with coordination and consultation.
Thank you, sir. There was one other comment on, do you think the trust in a globalized world will reduce or has reduced post-pandemic? I mean, that's more a comment, but if anyone just wants to respond to that, as perspectives from the youth too.
Yeah, I think it's the young people who should respond because they're going to be actually living in the world longer than we are. So they must
I'll put that
their
out
perspective.
to you. Yes, yes, sir. So Purva or Sai Krishna, Vishal, does anybody want to respond to that?
I can attempt to take this one.
Yeah.
Now, in terms of, and this is me providing my perspective on this question. In terms of trust in a globalized world, it will be a yes and no both. Considering that we have seen certain failures in globalization, especially amidst this pandemic. But we've also at the same time seen opportunities of collaboration, cross-country collaborations, and one country cannot have all resources that it needs to sustain human life. It may be at the basics, yes, but if you were to talk about rapid development and growth of the country, it's always, I mean, there's always more scope for it when it's being done with bilateral or multilateral exchanges with other parts of the world. This pandemic has also taught us that we have strengths and we have weaknesses when it comes to talking about globalization as a whole. I mean, it's a very big term to directly just say yes or no. But I think we've highlighted what works and what doesn't work. So maybe in terms of what doesn't work in this globalization era, are opportunities for us to fix them as leaders of the future, because we have seen what has failed potentially, especially in terms of the lives lost, mistakes, the costs of the mistakes that we made just while being the most globalized version of the world we've ever seen. And also to capitalize on the good that's come out of it, to capitalize on the learning experiences that have been shared, also to capitalize on just how much has come out of collaborating on both humanitarian basis as well as on more business and non-humanitarian basis as well.
Well said.
Yeah, I agree. Very well said, Purva. So 1 minute left on this panel. So would you, the public health representatives, want to add from your perspective?
Yeah, hi ma'am. So I would like to take this. So at the risk of delving into real politics and geopolitics, I would like to say that we are already part of a very, very multipolar world with a very nice gentleman taking the helms of the United States, and China kind of dominating the entire global scene. What I feel is that with the coronavirus spreading and the world becoming more insular, we might look at a major shift in geopolitics, in the sense that globalization might not crumble entirely, but at some level it might morph into something more localized, as if say one country in a specific region might become more prominent or more powerful, and that might be it. Like, not many countries might have the resources or honestly the geopolitical strength to exert themselves internationally as they once could. Globalization basically ran on the power of Bretton Woods, which was instituted when a post-war America took helms of the entire world and faced off with the Soviet Union. The days of the superpowers are gone. Even China, the world's financier, is being looked up as some sort of a culprit in this entire situation. Definitely the trust in globalization will wane, definitely it will wane, but we have to realize that we cannot just do away with an interconnected world. That's just how humankind works. We need each other. So that's my 2 cents on it. Thank you.
So any closing thoughts?
No, I think these are stimulating thoughts. Some of the thoughts could actually be subjects of a debate, but I believe that we will require global solidarity to face common global threats. But even in that environment, we need to be fairly self-reliant as much as possible. You cannot be euphoric about globalization and depend entirely on imports of essential goods, whether it's medicines or other elements. So I think we bring a better balance into our understanding of globalization. A Portuguese writer called Miguel Targo said, universal is local without the walls. So a lot of action will have to be local, but we have to break down the walls so that knowledge can flow freely and global solidarity can assert itself when there are common global threats.
Thank you so much, sir, for summarizing that. And I'm really thankful to all these representatives from the student community, both from the medical field as well as from our public health institutes. It's really refreshing to be on a webinar like this and hear from younger voices. I mean, we've been flooded with webinars where we're hearing from expert professionals. So we were really excited to host this one. But thank you very much to the panelists, both from the public health community as well as the medical students. Thank you, sir, for hosting and moderating that discussion. There are a few comments in the chat box. I'm not sure whether I should direct it to you. We could take about 5 minutes. There's one question asking, why are we not using a horizontal approach to deal with this pandemic? Different states are facing different issues, and a population-based approach for prevention. We still seem to be more focused on curative care.
Well, basically, if by horizontal approach you mean that each state should be able to take its own decision rather being guided entirely by central policies or diktat, I would agree with you. Certainly in the face of a new pandemic, particularly when flights are coming in from outside, bringing in potentially virus-infected persons, there has to be a national policy that has to set in motion. And the response has to be organized at the national level through center-state consultations. But as the epidemic advances, certainly you need to actually move to the state level and then into the district or even the sub-district level, where the decisions will have to be made on data collected and analyzed as close to the field as possible. So having policies made at the central level, planning at the state capital level, but execution or implementation at the district level, or even actually at the ward and village level would be the ideal way to go. And even if we had begun with a slightly top-down approach, this is the time for us to decentralize. Decentralization with coordination and consultation.
Thank you, sir. There was one other comment on do you think the trust in a globalized world will reduce or has reduced post-pandemic? I mean, that's more a comment, but if anyone just wants to respond to that, more as perspectives from the youth too.
Yeah, I think it's the young people who should respond because they're going to be actually living in the world longer than we are. So they must
I'll put that
their
out
perspective.
to you. Yes, yes, sir. So Purva or Sai Krishna, Vishal, does anybody want to respond to that?
I can attempt to take this one.
Yeah.
Now, in terms of, and this is talking as this is me providing my perspective on this question. In terms of trust in a globalized world, it will be a yes and no both. Considering that we have seen certain failures in globalization, especially amidst this pandemic, but we've also at the same time seen opportunities of collaboration, cross-country collaborations, and one country cannot have all resources that it needs to sustain human life. It maybe at the basics, yes. But if you were to talk about rapid development and growth of the country, it's always, I mean, there's always more scope for it when it's being done with bilateral or multilateral exchanges with other parts of the world. This pandemic has also taught us that we have strengths and we have weaknesses when it comes to talking about globalization as a whole. I mean, it's a very big term to directly just say yes or no. But I think we've highlighted what works and what doesn't work. So maybe in terms of what doesn't work in this globalization era, are opportunities for us to fix them as leaders of the future, because we have seen what has failed potentially, especially in terms of the lives lost, mistakes, the cost of the mistakes that we made just while being the most globalized version of the world we've ever seen. And also to capitalize on the good that's come out of it, to capitalize on the learning experiences that have been shared, also to capitalize on just how much has come out of collaborating on both humanitarian basis as well as on more business and non-humanitarian basis as well.
Well said.
Yeah, I agree. Very well said, Purva. So 1 minute left on this panel. So would you, the public health representatives, want to add from your perspective?
Yeah, hi ma'am. So I would like to take this. So at the risk of delving into real politics and geopolitics, I would like to say that we are already part of a very, very multipolar world with a very nice gentleman taking the helms of the United States, and China kind of dominating the entire global scene. What I feel is that with the coronavirus spreading and the world becoming more insular, we might look at a major shift in geopolitics, in the sense that globalization might not crumble entirely, but at some level it might morph into something more localized, as if say one country in a specific region might become more prominent or more powerful, and that might be it. Like, not many countries might have the resources or honestly the geopolitical strength to exert themselves internationally as they once could. Globalization basically ran on the power of Bretton Woods, which was instituted when a post-war America took helms of the entire world and faced off with the Soviet Union. The days of the superpowers are gone. Even China, the world's financier, is being looked up as some sort of a culprit in this entire situation. Definitely the trust in globalization will wane, definitely it will wane, but we have to realize that we cannot just do away with an interconnected world. That's just how humankind works. We need each other. So that's my 2 cents on it. Thank you.
So any closing thoughts?
No, I think these are stimulating thoughts. Some of the thoughts could actually be subjects of a debate, but I believe that we will require global solidarity to face common global threats. But even in that environment, we need to be fairly self-reliant as much as possible. You cannot be euphoric about globalization and depend entirely on imports of essential goods, whether it's medicines or other elements. So I think we bring a better balance into our understanding of globalization. A Portuguese writer called Miguel Targo said, universal is local without the walls. So a lot of action will have to be local, but we have to break down the walls so that knowledge can flow freely and global solidarity can assert itself when there are common global threats.
Thank you so much, sir, for summarizing that. And I'm really thankful to all these representatives from the student community, both from the medical field as well as from our public health institutes. It's really refreshing to be on a webinar like this and hear from younger voices. I mean, we've been flooded with webinars where we're hearing from expert professionals. So we were really excited to host this one with all of you. So thank you so much for coming here onto this platform and sharing your thoughts on this platform. Thank you so much, sir, for hosting and moderating this discussion.
It's a pleasure.
Thank you. So we do have a lot of comments in the chat box. I think we can share it with some of with the Medical Students Association as well as the Public Health Institutes. Lots of thoughts out there to share with the youth on this platform. So let me move us on to the second panel. Again, just like in the first, we have two students from medical community, as two from the Public Health Institutes. The two representatives from the Indian Institutes of Public Health, Delhi, Jyotsna and Aishwarya. And from the Medical Students Association of India, we have Mauli and I think Salman Khan. So I'll hand over now to the moderator of panel 2, Dr. A.K. Shivkumar. Himself a New Delhi-based development economist, policy advisor and evaluator. He's a visiting professor of economics and public policy at the Indian School of Business, in the Young India Fellows Program at Ashoka University and at Harvard's Kennedy School of Government. So Dr. Shivkumar is going to be leading the panel 2, which is got the theme, Reclaiming the Environment, What Can the Student Community Do? Over to you, Dr. Shivkumar, to address the youth in this panel.
Thank you very much. And it's a great pleasure to meet all of you and have this interaction. Like Dr. Srinath Reddy was saying, it's very important for us to listen to the voices of young people because when you talk about either health or environment, these are all long-term dimensions of human life that we need to address. So we saw in the first panel a whole conversation on health and COVID and the impacts and what we need to do. But in this session, as an economist, I would also like to bring out the fact that in addition to the massive health crisis, there is also an economic collapse. And inbuilt in that collapse, you will find are manifestations of extreme forms of inequality and injustice. And I think as a medical community and as a public health community, it is important for all of you to engage with these societal concerns of equity, justice, and fairness. So now if you juxtapose on what is happening in terms of the threats to lives and livelihoods, what climate change brings to as a third dimension, it is completely scary. I mean, it's so uncertain because the manifestations of climate change we are seeing in extreme weather conditions, higher intensity of cyclones, and now also the locust attack and so on and so forth, which has very serious consequences for people. And in fact, when you look at the human impacts of climate change, it actually operates quite a bit through the health impacts. So from that point of view, I want to start by posing a question, which is, we're looking at reclaiming the environment and what the student community can do, keeping in mind both the health aspects, the environmental aspects, and the social dimensions of human lives. Let me start by addressing this question to Jyotsna Bedi. Jyotsna is a second-year student with the Institute of Public Health in Delhi. And Jyotsna, I'd like to start by asking you to share your thoughts on the impact of COVID-19 on our environment, what is good about it, what is bad, and what is ugly about this.
Hello everyone, thank you sir for the question. So what's good about COVID-19 impact? We have seen a lockdown, a huge lockdown all over around the world, and we saw that there has been, a clarity of vision in of air. Like there's a air quality improvement. There has been improvement with the wildlife. There has been improvement in water quality. We have news that Venice River is clearer now. We had a news that Ganga is clearer now. We had news that Mount Everest is visible from where Bihar, and lots of such things that wildlife. We actually, when I get up in the morning, I can literally hear birds chirping. I mean that sound. My father tells me that this sound I haven't heard since 20 years or more, and this is now I'm hearing this, and this is a very big benefit. But and we have been, let's come to the bad and ugly part, because that's more important. And because we have been bragging about the good part a lot, but what's about the ugly part? Number one, that the material that is being used for logistics for COVID-19, masks, PPEs, what is that material made up of? Most of that material is made up of single use plastics. Single use plastics are one of the most hazardous things that we have for our environment. And if and this way and India right now is producing that in tons, and that is very crucial now. Second, uh, there was a news that came from Africa. I recently read that there has been a bushmeat hunting there, and this is because the localites are doing it because bushmeat, because there has been a reduction in tourism because of the lockdown, and there has been no tourism. They need their livelihood, so they are hampering the environment. They are hampering wildlife. So now, what's the ugly part? Ugly part is that all this is a very alarming situation. How? Climate change itself is a slow pandemic. We last 55 days, Delhi NCR region has seen six earthquakes. We have seen two big cyclones, Amphan and Nisarg. And on top of that, COVID-19 situation. What is COVID-19? COVID-19 itself is an environmental problem. How? COVID-19 itself is an environmental problem because obviously what is climate change? Climate change is humans hampering the environment, humans hampering the natural resources and get coming out, and these are the resources and overusing the resources. So that the increase there is a increase in the burden of resources. So now what is COVID, what how is COVID-19 connected with environment? Obviously somebody has used somebody has got exposed to the pathogens in the environment. They have hampered the environment, they have hampered the creatures in the environment and got exposed to the pathogens. This is how COVID-19 came in. So and pandemics like SARS, MERS, so all these pandemics are a part of environment. So obviously this is a very alarming situation for us, that we already have a pandemic situation, that is a climate change situation, and on top of that we encounter a pandemic situation, that is a COVID-19 situation, that is a situation related to viruses. So if all these increase, then how are we going to deal with this? This is the ugly part. This is what we need to focus on. That how are we going to increase this? How are we going to deal with this in the future? How are we going to actually emphasize that what are the strategies we are going to follow? And on top of that, our economy is going down. We don't have good economies. Almost all countries. We spoke about globalization lagging down, right? We spoke about globalization has, like, it's gone, and China, the biggest global power, is going down. So what is all this economy? And if the economy is going down, then there is a direct impact on our SGDs, because we'll encounter more poverty. Governments won't be able to invest in SDGs like water and sanitation, food for all. There are a lot of sustainable development goals that need a lot of economy in them. We lack in that also. So how are we going to deal this? This is an alarming situation, and this is the ugly part. We have bragged a lot about the good part, but we need to focus on the ugly part, that how this arise and what are we going to do for the SDGs now. Thank you.
John Mike. Yeah. Thank you, Jyotsna. That was very powerful and very clear articulation of the good, bad, and the ugly. Let me pose the same question to Salman Khan, who is a third-year medical student at Grant Medical College and the associated JJ Hospital in Mumbai. He's also serving currently as the National Officer on Public Health at MSAI. So, Salman, let's hear from you what you think are the good, the bad, and the ugly of the impact of COVID on our environment.
Thank you so much for your question, sir. And I hope everyone is doing fine during the pandemic. I can't enable my video right now because I'm experiencing some connectivity issues. So I would like to start off by shedding light upon the good impact by COVID-19 on our environment. Pollution and greenhouse gas emissions have fallen across continents as countries try to contain the spread of novel coronavirus currently. For instance, Delhi is notorious for its deteriorating air quality index, and it witnessed improvement in the initial weeks following the nationwide lockdown. Its average air quality index was around 128, which has been the cleanest March since the last 5 years for Delhi. The air data quality, which was compiled by the Central Pollution Control Board on 1st of April, showed that there was an improvement in the air quality across 99 cities and towns in our nation. It's a very positive thing. However, we are not really certain if this is just a fleeting change or it could lead to long-lasting falls in emissions in the future. Coming to the bad impact, we all know we began a year with the Australian bushfires, and now we are in the middle of the pandemic. Initially, there was a worldwide movement for climate change and planet advocacy. We at MSAI also continue to reach out to the general population and spread the message of planet advocacy through our on-ground events. However, the SARS-CoV-2 outbreak kind of overshadowed all the pre-existing issues in the world, and the movement got diluted. As a result, climate change has taken a backseat in everyone's minds, and the pandemic continues to be the biggest challenge at hand. People have failed to realize that the detrimental effects of climate change are still there in the similar magnitude. Moreover, natural disasters like, for example, the cyclone Amphan caused not only extensive damage to the Sundarbans, but also made things really complex for us to handle during this situation. As we are celebrating World Environment Day today, an uninvited problem that could make things way too uglier for our environment is the issue of the disposal of masks and gloves. According to a recent report by Worldwide Fund for Nature, the report said if 1% of the masks were disposed of incorrectly and dispersed in nature, this would result in as many as, say, 10 million masks per month polluting the environment. And if we consider the weight of each mask around 4 grams, that would result in a dispersion of more than 40,000 kilograms of plastic in nature. That was mentioned in the report. To summarize the points that I elaborated, it's time for all of us to realize that climate change will see no race, no practice of faith or gender, while inching towards ravaging human civilizations. So at the end, it's everyone's collective responsibility to preserve our planet for themselves and the future generations of flora, fauna, and of course, us humans. And that's all I wanted to say.
Thank you, Salman. I think both of you have brought out the positive side of what is happening with the COVID-19 in terms of the changes that we see in the environment. The challenge, of course, is to see how we maintain this, because given how easily, we should say, Indians or Delhiwalas in particular slip into the traditional routes, it won't be too long, I feel, before they all get in. So the challenge really for you as young people is to also think about what you can do to use this as the launching platform for really planning some kind of an environmental movement in Delhi itself. Okay, let's move to the second question. And the second question is actually, I mean, I sort of touched on it, and it says, what is the role that you see for the student community in building back better in the post-COVID era? And this is where we really want you to tell us, as young people, given the complex governance structures, the political administration, the bureaucracy that we have to navigate decisions through, how do you really see the student community rising to the challenge of building back better in the post-COVID era? And this time, let me start with Mauli Mehta, who's a final year MBBS student. She's studying at GMERS Medical College in Ahmedabad and is also the Vice President for External Affairs at MSAI. So over to you, Mauli.
Thank you so much, sir. Firstly, I would like to start by saying a very happy World Environment Day to all of you and to all our attendees. Thank you so much for your question again. And with respect to what our student community can do in terms of building back better, firstly, the post-pandemic era will surely be a challenge because as all of us are quite aware that the COVID virus is not going to go anytime soon. And one of the major risks which will be in exposure to that will be the fraternity of medical students, and how we are planning to like come back better is mainly through reaching out to local communities, because to be very honest, the entire time of the pandemic made us realize the importance of healthcare and the importance of reaching out to local communities, and that is one of the most important that is the essence of what we also do at the Medical Students Association of India, by conducting on-ground events with local communities, with medical students, with the general population. We try to reach out to we try to reach out to them and make them aware about the awareness issues which are going on, and like on different focus areas. So that is one thing which we will very solidly come and work on. And also the second part of this covers medical students in terms of how we can build their capacity to make them better future healthcare professionals, and also in building their capacity with respect to making them understand the link between climate change and the link between climate change and health. And how we plan to do that is through conducting online trainings and on ground trainings and on ground sessions for them. Sorry, my bad. And that's how we plan to come ahead and build capacity, for all the medical students who are a part of our community, who are a part of MSAI. And to just add, 2020 is a very important year for us to work on climate change and to build our capacity in terms of advocacy. And I'm sure that once we've already started the transition of going into a post-pandemic era. So we are in a phase of transition right now, and the advocacy will strengthen up more. The role of students in terms of advocacy will be it'll strengthen up more, once we start working in the post pandemic era. And to summarize here, I feel, and to end on a positive note, what I feel is that the pandemic has given us a lot of time to think of various ideas and to think of various ways of how we can reach out to local communities. And that's what we will be working upon once we can start reaching out to local communities. And that's what we are hoping our best for, to reach out to them and talk to them and spread awareness about this. And yes, that's how we plan to build back better. Thank you so much.
Thank you, Mauli. I couldn't agree with you more. I think engaging with local communities, creating awareness, advocating the right kinds of messages, etc., is absolutely fundamental. And I think young people have an advantage in trying to enter houses and talk to people, even if they're older than you. I think that's something that you can easily capitalize on. Let me pose the same question to Aishwarya Rohatgi, who's a first-year MPH student at the Institute of Public Health. So Aishwarya, what do you see as the role of your student community in building back better in the post-COVID era?
Thank you so much, sir, for the
you.
question.
Aishwarya, we can't see you quite. You have, okay. Yeah, we can hear you. Yeah, go ahead. Go ahead. Sorry.
Sorry for the glitch. So being part of the student community representing the youth of the nation, I vehemently believe that it is our duty as well as our responsibility to take on this challenge of building back better. After all, we belong to the after all, the demographic dividend for India comes maximally from our generation. So before listing out a few strategies, I would say reclaiming the environment through harm reduction measures involves both individual and collective consciousness, because it's those individual actions which pool in and translate into a collective response at a larger level. So I would start by suggesting that our schools and colleges, they need to be more environment sensitive. And as we plan to reopen, we need to revise our education systems and curriculums to lay importance on environmental science and more on solutions. To start with, I think I would say that a life cycle approach needs to be adopted, where we need to start young and lead by example in front of even the school-going children who are at an impressionable age. We need to instill that good hygiene, making environmental friendly choices at an early age is necessary, and it is in tandem with nature. It would also instill good and positive health outcomes from the beginning, as these children would eventually grow into the next generation conscious adults. After this, I think my age group, the college girls, the youth, which are the young, vibrant minds, they can bring forth innovative solutions. Since millennials and the Gen X live in the digitalization age, I think we can help them use this advancement technology to resolve post-pandemic problems, or, for example, extra biomedical and general waste that has come out of this pandemic. Or for example, the problems like climate change, or the lack of workforce and last mile delivery in services and health sector, so that we can ensure a continuum of care to COVID and non-COVID patients through smart solutions. We need to inculcate that flavor of social entrepreneurship amongst all the student community, so that they can build in self-reliance, and which would be again in tandem with the national flavor of go vocal for local. Technology will be the future, and our students need to catapult sustainable environmental friendly technology that will see the day post-pandemic era. Also, we have seen examples of Greta and many young activists around the world who have led movements to conserve the only inhabitable planet that we have. So I think we as the student community, as budding public health professionals, should judiciously use our voices for the right reasons of development, which would a development that safeguards our future, a development that prepares us to face something even worse than a pandemic like the current one. I think all of us together as a community need to talk, debate, have healthy discourses at home, with family, with friends. And I believe that the more noises we make, the more we will be heard. Another point that I wanted to focus is that we need to create a niche demand for alternative eco-friendly solutions as opposed to the conventional ones, like more demand for renewable energy, alternative sustainable eco-friendly alternatives, refurbished health systems that would be affordable, accessible, available to everyone. Going on, I think on an individual level, in tandem with the Sustainable Development Goal 12, which speaks about responsible consumption and production, we all need to comply with the already existing rules and protocols as conscious citizens. We need to start small, but make those sustainable lifestyle switches. We need to support minimalism and be mindful of what we are consuming and using. And I think the 4 R's I would like to focus and reiterate on it: reduce, reuse, recycle, recover. Monitor your carbon footprint. I think one strategy that comes in mind is find a carbon scale, make the least carbon footprint option for you, which is most affordable and accessible. I think also social cohesion and community engagement comes at it has to be the focus to avert a mental health crisis amongst all its youth. So I think we can have dialogues, build secure communities to restrict the uncertainty of future and the stigmatization, which I think is more virulent, which will be more virulent than the virus itself. And the social fabric hence needs to be restored with more empathy and solidarity amongst the student community. I think towards the end, I would also like to focus that we as the student community needs to be create pressure and express our concerns about the policy and governance measures. The policy instrument usually revolves around carrot, stick, and sermons, and I think we need to have cognizance of these instruments and try to raise our voices so that there is an intersectoral coordination among them. In the end, I think as we move ahead, I would say that safety, trust, community, access, wellness, and sustainability will be the mainline agenda. The pandemic is definitely the great equalizer, and my last message would be learn to unlearn, rethink your choices, coexist rather than coercively exist, and find the concepts of preventive health, community health, the balance between One Health and Planetary Health would help us drive building back better, would help us drive a healthy and green recovery in the post-pandemic era. And I would like to just end by a quote which I am personally very inspired by Reddy sir. Never before in human history have we been forewarned of a doomed destiny, but never before in human history have we so forearmed with the knowledge and tools that can alter the course of that destiny. So thank you so much.
Thank you. That was really exhilarating and very, very insightful comments from this young generation. If I were to quickly sum up what I take away from your comments, I think you'd point to three sets of actions. First is the importance of individual actions. I think when you're building back better, it has to start by setting an example. You have to practice what you preach. So it's easy to talk about sustainable consumption. It is easy to say for doctors to advise people to change their lifestyles and start walking and start exercising and eat healthy foods. But it's also very important to be the ideal or the idol for people to look at and say, wow, this is the doctor that really practices what he or she preaches. And I think that's extremely important. And I think it's also important in that sense to break social norms that do injustice to society. For instance, there's a lot of domestic violence against women in this country and against children. The first person who comes into contact is the public health worker or the medical profession. And to be very conscious of that, you have a social obligation, and it's an individual obligation and responsibility. When you're talking about building back better, it's also about building back better societies that have a good environment and are also safe for women. The second is, I think there are a whole set of professional actions, and in any profession, medical profession or public health profession, we often talk about striking a balance between knowing, doing, and being. And I think the knowing part, I think the medical profession is very good at it. The doing part, I don't have to say, you're all operators. I shouldn't say operators. I said you all operate and really practice medical practice. But the being part is where I think there are large gaps in the professional knowledge. And this is what I was saying, having an empathy for people, understanding better the social determinants of why people use healthcare facilities or not, the sense of discrimination and indignity that people face when coming to a hospital. I think these are extremely important for young people. And I know that you young people have really no interest in caste or religion. And so when you're at this generation, the older generation is caught and trapped in all those things. But I really hope that the being function, you evolve as really genuine professionals with a sense of being, a sense of purpose, and a commitment to society. And lastly, I just want to pick up on the first panel also, which is the importance of state actions. No amount of individual action and professional actions can result in anything unless there's a very strong state and a welfare state that's genuinely committed to serving the interests of people. We heard about the low levels of public investment. In fact, there is no country in the world that has achieved universal healthcare without the public provision of universal primary healthcare. And so we really have to look at the incentives and the well-being of frontline workers and so on, and push for the public sector in health. In fact, the COVID pandemic really tells us that if without the public sector, if we had to rely on the private sector like we all do, 70–80% of healthcare is now provided by the private sector. Without the public sector, we would have all, God knows where we would be by now. So I think so that big messages that I take. So if you really want to build back societies, build back better societies, we have to invest in individual actions, professional actions, and push for state actions. So let me stop there. And if there are any questions, Purnima, you might want to channel them to the students.
Actually, yeah, for this panel, there's more comments than questions. Actually, there was a question, I think, to Dr. Reddy, but he's probably left us because he was called away to another meeting. Comments include building back better would be enabling community adherence towards the new normal of preventive methods. The Korean government has already announced an everyday quarantine program that is a roadmap back to normalcy after the pandemic to instill these preventive methods and behaviors of the communities. I think with the Unlock 1, Unlock 2 that is coming on, there are various opinions being shared, and I agree with some of the points raised over here that this has to be a very decentralized approach. Dr. Reddy also stressed on that. I don't know if anybody from the panel over here, either panel 1 or panel 2, wants to share some closing thoughts. We're on top of the hour over here and towards the end of the webinar session. So are there any closing remarks from anyone over here on either panel in response to any of the questions raised already in the two panels, or as closing thoughts?
Is it okay if I can go?
Yeah, go ahead, Purva.
Okay, so I just saw a comment that really struck a chord with me in terms of, I can find it again, but it kind of talked about involvement of young people in decision-making processes. And I understand that we have a multi-generational audience and also the moderation panel with the speakers. And if I had, I'm just trying to make the best use of this space that we've come together in. There's only so much change we can make as a young generation, or our older generations can make as a segment. And what I see and what disturbs me on a spiritual level is climate change has suddenly become a youth problem, or just okay, so this is what you have to be dealing with. And I don't want to sound very condescending here, but it's also important for everybody to realize that we are in this mess because somebody messed up for us. And I was in a conference a couple of months back, and it still stays with me. And this woman walked up to me, and very knowledgeable woman. She walked up to me and said, "This is what you young people should do." And I think that's something that keeps playing in my mind. And why is it that we young people have to do? When I'm happy to, on behalf of young people, say that we have so much to do, but there's only so much we can do when the decision making is not entirely in our hands. And it's a collaborative effort that we will need, and we've constantly needed in the past, but now more than ever, to come together and give young people a seat at the decision making table, here, young people, we might not be the best generation in terms of a treasury of experience, but there is some energy, enthusiasm, and motivation that we could contribute and bring to the table, bring back to the table. And also, there are multiple studies that say that the Gen X cares much more about putting the society back in place, making real change in, and that's what they also seek in the kind of jobs they take up and the kind of professions they take up. And I think not technically Generation X, but I do resonate with that too. So it's just a call for all generations to work together and recognize that this is not a youth problem. Thank you.
Thank you so much, Purva. I think on that note, I want to once again thank Dr. Shiv Kumar. Thank you so much for taking the time out. I know you had to reschedule some meetings to do this. Thank you so much. It's been a pleasure having you host this. Thank you to Dr. Reddy as well. I think he had to leave us for another call. And thank you especially to all the panelists here, both from the Medical Students Association of India, all the representatives, Mauli, Purva, Salman, and who am I missing? Arpita, and all the students from the health institutes across our campuses, Aishwarya, Vishak, Sai Krishna, and who's the one I'm missing? Sorry. Jyotsna. So thank you so much. It's been such a refreshing hour and a half listening to you all, such wonderful insights, sharing with us, how this pandemic has played out in your lives, not just personal, but also academic and professional. And I mean, it's a thought that many people may not have recognized or identified. So it's nice to hear from you firsthand on how this has impacted you and your lives. And we've also heard about your thoughts on the student community strategies going forward for reclaiming planetary health, and everything from going vocal for local to eco-friendly, sustainable options, maintain your carbon footprint, learn to unlearn, and to coexist. I think, and the takeaway at the end, Purva, like to bring the youth voice to the decision table. I wish there's somebody hearing out there, a youth parliament, I think certainly in order. Maybe some of the decisions can do with perspectives from young people like you. You are the future. Excellent thought leaders that we have in the making. So thank you so much for sharing all your insights on this panel here today. I think it's a Friday evening well spent, and I hope we can have more interactions with young people like you and learn from your experiences and your perspectives. Thank you once again for all your time. And I'm sorry that we haven't been able to take too many questions. This was hour and a half, but very nice to have just heard from all of you and from the experts who moderated